So hello friends, now in this particular video we are moving to the next topic of our discussion. In previous video we have discussed about the antihistaminic drug in detail. Now this is the time for the discussion of antiserotonergic drugs, or the serotonin in short. And this is the next part of our Autocoids series. So let's start with the basics. First we will discuss the general introduction of the serotonin. It is found in serum, so it is known as serotonin. So please, before starting the video, I will request all of you, please subscribe our channel and support us. We will continue posting such videos. Please subscribe our channel. So please subscribe our channel. Now coming to the synthesis part of serotonin. So first, tryptophan. By the action of enzyme tryptophan hydroxylase, it will be converted to 5-hydroxytryptophan. Then by the action of tryptophan decarboxylase, it will be converted to 5-hydroxytryptamine, that is known as serotonin. And by action of MAO-A enzyme, it will be metabolized into 5-hydroxyindole acetic acid. Clear? So this is the basic synthesis process of the serotonin. Now we can inhibit this enzyme, that is tryptophan hydroxylase. The drug is your telostant ethyl. This is the drug which will inhibit the enzyme, that is tryptophan hydroxylase. This drug is telotrestat ethyl. Telotrestat ethyl, and it is used for the treatment of diarrhea in carcinoid syndrome. We have discussed carcinoid syndrome in our pathology videos. So this drug is used for the treatment of diarrhea in carcinoid syndrome. Now coming to the next part. Now one more thing, source of the serotonin, it is intrachromaffin cells, then platelet, then CNS. Now coming to the next part, that is receptors. Now we will discuss the receptors and its type, along with the effect on our body. So we will discuss 5-HT1 to 5-HT7 receptors. Now one more important point, all of these receptors are GPCR in nature, exception 5-HT3. 5-HT3 is your ionotropic receptor. So this is frequently asked MCQ question. That which of the serotonergic receptors belong to ionotropic group? So 5-HT3, remember this. 5-HT3 is your ionotropic, rest all others are GPCR. Now we have drugs for 5-HT1 to 5-HT4, so we will confine our discussion to these receptors only. Now starting with the 5-HT1, so they are located in CNS, as presynaptic autoreceptor, and they are of GI type. So 5-HT1 is GI type. So please, anyone please comment then which histaminic receptor is GI type. Which histaminic receptor is of GI type. So coming to the 5-HT1 agonist, so the drug is your buspirone. This is 5-HT1 agonist, and because of this activity it is working as anti-anxiety drug. Now moving to the second, that is 5-HT1B 1D agonist. 5-HT1 receptor is divided into many groups. We are discussing the important one, that is 5-HT1A agonist, 5-HT1B 1D agonist. That groups of drug are known as tryptopans. Triptans. And the second group is your ergotamines. They are non-selective, but triptans are selective, and triptans are very important. Why they are important, we will discuss later on. And these drugs, basically 5-HT1B 1D agonist, are used for the acute attack of migraine, and the drug of choice is your triptans. So remember this, for the treatment of migraine we use the drugs triptans. Clear? Now 5-HT1F agonist, so one drug is there, lasmiditan. Lasmiditan, and this drug is under trial for the acute attack of migraine. Now coming to the 5-HT2 receptor, so most important point in 5-HT1 is GI type and triptans. Now 5-HT2, they are located in various organs, as postsynaptic receptor, and this is 5-HT2 is your GQ type. Clear? Now going to the drugs, so 5-HT2C agonist. If you give this drug, then it will decrease your appetite by working on the CNS. And one drug, lorcaserin, remember this, lorcaserin is 5-HT2C agonist. Clear? So they are used for the anti-obesity drug. Then 5-HT2A, 2B, 2C antagonist, remember the clozapine and olanzapine. Clozapine and olanzapine, these are the antipsychotic drugs basically. Clear? Atypical antipsychotics, we will discuss that antipsychotic drugs are divided into two groups, typical and atypical. So olanzapine, clozapine, quetiapine, they all belong to atypical antipsychotics. Clear? And the side effect of all these drugs are obesity, because it increases appetite. And for treating this side effect, we will use metformin. Now coming to the 5-HT2, 5-HT3 and 5-HT4 antagonist. Okay. So first, ketaserine, ritanserine, cyproheptadine, methylcerazide. Okay, these all are belonging to this category. Okay, and they are basically drug of choice for migraine prophylaxis, serotonin syndrome, like this. Okay, so remember the drug: ketaserine, ritanserine, cyproheptadine, methylcerazide. Okay, one two point important: cyproheptadine also increases your appetite. This methylcerazide is banned. Okay, now coming to the important points about the 5-HT receptor subtypes. Now 5-HT1 we have discussed autoreceptor, so it will inhibit serotonergic neurological activity in brain here. Okay, 5-HT1A present in raphe nucleus and hippocampus. 5-HT1DB they constrict cranial blood vessels and inhibit release of inflammatory neuropeptides in them. So these are some important activities which are related to 5-HT1 receptors subtypes. Okay. 5-HT2A previously D-type receptor was this was D-type receptor. Okay, most important post-junctional receptor mediating direct action of 5-HT, like it will mediate vascular and visceral smooth muscle contraction, platelet aggregation, neuronal activation in brain. So these three activities are very important, which are mediated by 5-HT2A receptors. Okay, vascular and visceral smooth muscle contraction, then platelet aggregation, then neuronal activation in brain. Now going to the 5-HT3, previously M-type receptor, it depolarizes your neurons. Okay, it depolarizes neurons by opening cationic channels or like that. Clear? And it also elicits reflex effects, such as it may lead to emesis, bradycardia, gut peristalsis, apnea, like this. Then 5-HT4, it mediates two things: intestinal secretions and augmentation of peristalsis. These 2 points are very important. Okay, that 5-HT4 receptors agonist mediate basically intestinal secretions, and it also mediate augmentation of peristalsis. Okay, and 5-HT3 important, emesis. Okay, because as an antiemetic drug we give 5-HT3 antagonist. Clear? Okay, move to the next part. Now coming to the 5-HT4 receptor function in the gut. These are the very important point, because in our GIT we will discuss this group again, but remember these points here. 5-HT2A, it lead to contraction of the intestinal smooth muscle. Okay, and 5-HT3, it basically causes fast depolarization of enteric plexus neurons. Okay, and 5-HT4, it will increase your peristalsis and secretion, as I have told you. Okay, clear? So this is the basic idea about the receptors, how receptors are working, or that. Okay, we were discussing basically drugs targeting the group. Okay, see here, we were just discussing the drugs. Okay, we will come to that again. In between I have discussed about some receptors like this. Now coming to this ergots, so they are the derivative of claviceps purpura. Okay, it will stimulate all 5-HT receptors, okay, except 5-HT3, because it is ionic in nature. Drugs are ergometrin and dihydroergometrin. Now stimulate dopamine D2 receptor. Along with this, drugs are bromocriptine, cabergoline, okay, and pegolin. Clear? And these are drugs used for Parkinson disease, procalcitonin. Then stimulating oxytocin receptors are ergometrin, dihydroergometrin, methylergometrin. Okay, they are used for control of PPH. So this is the basic intro about the receptors and that. Now coming again to the drugs. We have discussed about the 5-HT2, 5-HT3, 5-HT4 antagonists. Those drugs such as ketanserin, datanserin we have discussed now. Sorry, we have discussed these drugs. So these drugs are 5-HT2, 5-HT3, 5-HT4 antagonists. Okay, ketanserin, datanserin, cyproheptadine, like this drug. Now coming to the 5-HT3. So 5-HT3 antagonist first. So these drugs are divided into two groups. Okay, first, that is chemoreceptor trigger zone, and the second GIT. Okay, first coming to GJ, orange-cetron, granisetron, tropisetron, palonosetron. These all are antiemetic drugs. Okay, because they are 5-HT3 antagonists. I have told. Okay, 5-HT3 mediating emesis. So if you give antagonistic drug, then it will be acting as antiemetic drug. Okay, and this palonosetron is longest and most potent out of these drugs. Now on GIT, if you give antagonist, okay, it will decrease the motility. Okay, so they are anti-motility drug. Okay, elocetron and silancetron, two drugs are there, elocetron and silancetron. Silancetron is not written, you can add silancetron. Okay, they are anti-motility drugs, so they can be given for the treatment of diarrhea in irritable bowel syndrome. So basically these drugs are used for the treatment of diarrhea. Okay, so these drugs are used for the treatment of diarrhea as well as emesis, both. Emesis consists of ondansetron, granisetron, tropisetron, pelanosetron, as antidiarrheal consists of elocetron and cilancetron. Clear? And these group of drugs are drug of choice for chemotherapy-induced nausea and vomiting. Remember this. These drugs are drug of choice for radiotherapy-induced nausea and vomiting and GIT infections. Okay, GIT infection-induced nausea and vomiting. In all these three cases, these drugs are your drug of choice. Clear? And side effect of all these drugs are prolongation of QT interval. Clear? Okay. Now coming to the one separate topic, that is antiemetic drugs for chemotherapy-induced nausea and vomiting. Clear? So we have discussed 5-HT3 antagonist. They are the drug of choice for chemotherapy-induced nausea and vomiting. Effective only up to 24 hours. Okay. In early phases of chemotherapy, we give this drug. Now, other group of drug is NK1 stimulant. Okay. NK1, basically we will block the NK1. Okay, neurokinin 1 blocker we can give, because this will induce your stimulation, induces emesis. So we give neuro NK1 blockers such as aprepitant, fosaprepitant, okay, netopitant, rolapitant. These are the drugs which are given. Clear? Now coming to the cannabinoid receptors. Okay, so we give CB1 agonist because depression of CB1 induces emesis. These drugs consist of nabilone and dronabinol. Clear? So we are discussing antiemetic drugs here. Okay, for chemotherapy-induced nausea and vomiting, we are covering that part also. And the last drug is your dexamethasone. It is an add-on drug to any CINV. Okay. Now moving to the coming to the 5-HT4. So 5-HT4 agonists are known as prokinetics. Clear? 5-HT4 agonists are known as prokinetics, and it will increase your GIT muscle contraction. Clear? It will increase your GIT muscle contraction, and its use is for GERD, and it also decreases the risk of aspiration of gastric content. So it is used during and before surgery. Remember this. It also increases your intestinal motility, so it will be given for constipation, because it closes your lower esophageal sphincter and increasing your gastric motility. For that reason, GERD and less risk of aspiration we have used, and it increases your intestinal motility, so can be given for constipation. Clear? And the drugs are CM trip. Okay, CM trip. This will be trick, cisapride, then mozapride, then tegaserod, then renzapride, etopride, and procalcipride. These are drugs. Etopride is also D2 blocker. Okay, it is not a 5-HT4 agonist. Clear? And the cisapride is banned because of the increased risk of QT prolongation. Okay. Now coming to the one more important drug, that is metoclopramide. Okay, it has various mechanism of action. It is a D2 blocker, 5-HT4 agonist. Okay, and also 5-HT3 antagonist. It will be only at higher dosage. Okay, only at very high dosage it will be acting as 5-HT3 antagonist. Clear? Means antiemetic function will be there associated with that. Now D2 blocker, so it will be acting as antiemetic, prokinetic, antiemetic. Okay, all these functions are associated with metoclopramide. One important point, that it crosses your blood-brain barrier. Okay, and block D2 receptor there, so it will cause drug-induced Parkinson disease. Okay, so remember this. Okay, side effect is this. Clear? This is very favorite question. Drug-induced Parkinson disease. The next drug is domperidone. It is only D2 blocker and it does not cross blood-brain barrier. So it is drug of choice for levodopa-induced vomiting. Now coming to the migraine. Migraine is important, and all we discuss migraine in this topic. Okay, serotonin. Or let's discuss this topic different topic. Okay, in different video, because this is somewhat longer. So I will discuss this in a different video. So thank you for watching. If you like the video, please subscribe our channel and please share with your friends. Thank you for watching. Best of luck.